Welcome to the presentation on gastrostomy tube care and tube feedings. This presentation was developed by the school nurses of Rio Rancho Public Schools in order to provide information to unlicensed personnel for the safe care of gastrostomy tubes, I'll call them G-tubes, medication administration through a G-tube, and feeding through a G-tube. Once you have reviewed this PowerPoint, you will need to review this information with your school nurse and demonstrate skills and knowledge of the information with your school nurse by using the skills checklist for gastrostomy feeding. In order for the nurse to delegate procedures related to G-tubes, unlicensed personnel must review this training yearly and demonstrate correct care of G-tubes through the skills checklist. If you're ever unclear as to what to do for students with G-tubes, need a review of the information, or become uncomfortable with performing tasks associated with a G-tube, contact your school nurse to review proper procedures to follow. This is your responsibility. In order for people to sustain life, they must be able to take in nutrients and water. Food is placed in the mouth, chewed, and swallowed. It then travels down the esophagus into the stomach where it is digested. Some people are born with or develop health conditions that prevent them from eating and drinking in the normal way, through the mouth. Gastrostomy feeding tubes can be temporary or permanent and are put in for different reasons. They may be recommended for people who cannot swallow correctly, people who cannot take in enough food by mouth to stay healthy, and people who often breathe in food when eating. A physician makes a small hole through the skin into the stomach. A small rubber tube is then placed through the hole and secured in place by inflating a balloon at the end of the rubber tube. Liquid nutrition or water is then drained into the stomach via the tube. It is always important to keep the gastrostomy site clean, dry, and protected from unexpected displacement. Some students may have a dressing over the insertion site, some students may have nothing covering the tube, and the tube and skin are open to air. This varies from student to student, and instructions on covering the site will be provided by the student's parent or healthcare provider. If there is a dressing and it becomes soiled, check with your school nurse about whether or not the dressing should be changed. The procedure for changing the dressing, if applicable, will be covered by the school nurse in the skills checklist review. In order for a trained employee to give a student water or liquid nutrition via a G-tube at school, the parent must obtain a completed authorization to administer specialized health services form from the student's health care provider. It is the responsibility of the parent to provide this form each new school year the feeding is requested, or when any changes are requested in the tube feeding. Tube feedings can provide the student with nutrition and/or water. There are 3 ways to administer liquid through a G-tube. The method of administration will be specifically identified by the healthcare provider in the student's health care provider orders. The 3 methods of administration are gravity, push, and pump. Gravity means an extension tube is secured to the G-tube button and a large syringe is hooked up to the end of the extension. Liquid nutrition and/or water is then poured into the syringe and allowed to drain into the stomach by gravity. Push means the syringe plunger is used to push the feeding in slowly. Pump means the feeding is pumped into the stomach using a machine. The student's health care provider will provide specific instructions about which method to use for administration of the feeding or water. More specific instructions on the administration method will be provided by your school nurse. Some medications can also be administered through a G-tube. Liquid medication can be diluted with water and given in the same manner feeding or water is administered. Some pills can be given through a G-tube. As long as the medication is okay to crush and will dissolve in water, it can be administered through a G-tube. Verify with the nurse that the medication can be administered through the G-tube. The training on medication administration must also be taken, and this information must be reviewed with your school nurse before giving any medication through the student's G-tube. Some common problems experienced with a G-tube are leakage around the tube or button. This happens due to a poor fitting button or defective balloon. As children grow and gain weight, the button may not fit up against the skin. If you notice leaking, notify the school nurse and/or parent or guardian. Another problem is drainage at the insertion site. It is considered normal to have some brown, yellow, or green drainage on gauze around the insertion site. It does not mean that there is an infection. However, if you notice bright red drainage or a large amount of formula draining from around the site, contact your school nurse or the child's parent or guardian. Also, consistent drainage of stomach content from around the insertion site can cause skin irritation and infection. The most important thing to watch for is fever. With the true infection, a fever is almost always present. Redness at the site is common and can be treated with a barrier-type ointment. Contact the parent to obtain the cream and an over-the-counter medication form before applying any cream or ointment to the site. G-tube displacement can occur. Replacement instructions will be provided by the student's healthcare provider. Your school nurse will provide more specific instructions on the procedure ordered by the student's healthcare provider. And finally, feeding tubes can become clogged, especially during medication administration. Clogging can sometimes be avoided by diluting medications in plenty of water and flushing well before and after administration of medication. If obstruction occurs, attempt to flush the tube with water. If this is unsuccessful, contact the school nurse, parent, or guardian. These are typical supplies needed for administering medication, water, and formula through a G-tube. It is necessary to gather all the needed supplies and/or medications if applicable so that the feeding can be administered without interruption. These are the steps to follow in performing a G-tube feeding. First, wash your hands and gather supplies. Position the child in an upright position. Then attach the extension tubing or adapter to the feeding syringe. Some providers will ask that the child's residual stomach contents be checked before administering a feeding. If this is ordered, your school nurse will provide you with specific instructions on how to perform this procedure. Next, prime the tubing with water. Open the G-tube and attach the extension tubing to the button, making sure the tubing is secured in place. Pour the feeding into the syringe and open the clamp to allow the feeding or water to drain into the stomach. Elevating the feeding high above the stomach will cause the feeding to drain at a faster rate, and lowering the syringe will decrease the flow rate of the feeding. Avoid fast administration of feeding, as this may cause the student to have reflux or discomfort. Fill the syringe before it's empty to avoid air from entering the stomach. Next, flush the tubing and syringe with water after the feeding is completed, and remove the extension tube and replace the safety plug if applicable. Make sure to keep the child upright for at least 30 minutes after the feeding. Wash the syringe and tubing with soap and water. Wash your hands and document the feeding and observations on the log. Report any problems you may have to the nurse. Push and pump feedings use the same steps. The difference is in the method of administration. Your school nurse will demonstrate and explain the appropriate method to use for your student. These steps will be reviewed using the skills checklist. The child's healthcare provider will provide specific instructions on the authorization to administer G-tube feeding form in the event the G-tube comes out accidentally. Immediately notify your school nurse and parent or guardian if this occurs, and follow the guidelines provided by your school nurse. Bleeding around the stoma or G-tube opening should be monitored closely. The procedure to follow in the event the G-tube comes out will be reviewed by your school nurse and demonstrated on the skills checklist. Signs that indicate the student is not tolerating feeding or water are abdominal distension and/or abdominal hardness, frequent gas or belching, large amount of residual noted in the stomach before the feeding is done, frequent vomiting, crying, restlessness, or agitation with the feeding. If any of these signs are noted, stop feeding immediately and notify your school nurse, parent, or guardian. Keep the child in an upright position. Venting can be done anytime there are signs of intolerance. Venting allows trapped air or excess fluid to escape into the bolus syringe. Attach an extension tubing to a 60 cc syringe and attach the extension tubing to the button. Unclamp the extension tubing and allow it to remain open for a period of about 10 to 15 minutes. Be sure to document the procedure and the results on the feeding log. These procedures will be reviewed by your school nurse when reviewing the skills checklist. Your school nurse will review all of the information provided in this presentation by providing you with one-on-one how-to information and demonstrations performing feedings, medication administration, and troubleshooting gastrostomy tubes. You'll need to demonstrate appropriate knowledge and skills with your nurse by using the skills checklist. Anytime you're unsure or need review of information, it is your responsibility to seek out your school nurse for clarifications. Now it's time for a short quiz to help you remember the main points from this training.